Hi, my name is Muhammad Zafran bin Said from DMOS 4A. This is my ID and my name. I want to present about dengue fever. This is Aedes mosquito carry of dengue fever. Characteristic of Aedes mosquito. Aedes mosquito is in tropical and subtropical climates such as Malaysia. Aedes mosquito have two types, namely Aedes aegypti and albopictus. Only female mosquitoes suck blood to produce new eggs. The focus of this mosquito sucking area in human is on the elbow, ankle and wrist. This is type of Aedes mosquito, Aedes albopictus and Aedes aegypti. Aedes aegypti mosquito often found indoor. The physical difference on the left and right of his head have white line. Aedes albopictus mosquito are often found in outdoor areas such as bush and areas where there are many trees. The difference in physical terms is having a white line in the center of the head. Effect of Aedes mosquito bite. This is symptom of dengue within 3 to 6 days after being bitten by an Aedes mosquito. This is effect. Vomiting, fever, red rashes upper on the skin, joint pain, and lastly lead to death. Okay, thank you.
Assalamualaikum. My name is Ismadanya bin Zuhairi. My ID number is 1200903175, and I will present about introduction part 2 for our final assignment about dengue fever. Aedes breeding places in occupational workplace. In sewage plant, the Aedes mosquitoes are breeding inside water reservoir pool, inside water pipeline, inside water tank, and inside water containers and others. In construction sites, Aedes mosquitoes are breeding inside water puddles, inside uneven floor that contains rainwater, inside food plastics, and more. Inside confined space, Aedes mosquitoes are breeding inside uneven floor that contains water, uh, at the leaking waters, and inside water pipeline. In factories, Aedes mosquitoes are breeding inside plastics, container, barrels, and other packaging that can contain rainwater or water. Cycle uh, cycle of infection of dengue virus. Cycle of infection are used to show how a specific infectious disease will affect other people. Uh, infectious disease. Firstly, the infectious disease is dengue virus, and the reservoir is Aedes mosquitoes. Portal of exit is how the infectious disease exit the reservoir into humans. The portal of exit is through mosquitoes bites. Mode of transmission is how the person infected transmit the virus to other people. The mode of transmission is through saliva from infected person count. Portal of entry is how the virus enter other people body. Firstly, through ingestion, uh, which the person eat the contaminated food that they contaminated by the saliva from infected person couch. And the second one is absorption, which direct mosquito, which from direct mosquitoes bites. Lastly, the susceptible host is elders, children, elders, workers, and employees, and basically everyone that got bite by the mosquitoes.
Greetings, and my name is Muhammad Ashraf bin Wam, and my student ID is 1200903190. And for this slide, I will present to you about the proposal objective. There are five objectives for our proposal. The first one is to show that dengue fever is highly dangerous and can cause death. The second one is to show that people can get infected from dengue at any range of age. The third one is to let people know that dengue viruses are normally located in tropical and subtropical climates. The fourth one is to let people know that those who are infected will experience an increase of hematocrit levels and the drop of the platelets. And the final one, the fifth one, is to let people know there is no special treatment for those who have been infected, except for fever reducers and painkillers. That is all for our proposal objective. Okay, greetings. My name is Mama Ashraf bin Wam, and my student ID is 1200903190. And for these slides, I will present to you about the medical surveillance of dengue fever. So, dengue fever. Dengue fever, or also known as dengue hemorrhagic fever, is a viral infection that is spread by mosquitoes or specifically Aedes. Dengue fever virus is normally located at tropical and subtropical climates such as South and Central America, Southeast Asia, the South Pacific, Africa, Puerto Rico, the United States Virgin Islands, and the Caribbean. The symptoms of dengue fever are such as continuous vomiting, nosebleeds, breathing difficulty, cold, rash, and restlessness. The diagnosing process for dengue diagnosis are hematocrit, or the percentage of blood that is composed of red blood cells and blood platelet, will be monitored. Dengue virus antigen detection, or also known as NS1 method, will be used. Result must be confirmed by molecular technique, or also known as the polymerase chain reaction, basically PCR. Those who is infected will experience increase in hematocrit levels and blood platelets will drop. As what you can see here, here is a chart of dengue cases in Malaysia. For your information, based on a recent report by World Health Organization, there were 99,169 dengue cases and 142 deaths from 2020 till 2021 was reported in Malaysia alone. There is no special treatment for dengue nor require specific medicine except for fever reducers and painkillers that can be taken to control the fever. An example of such medicines is acetaminophen or paracetamol. That is all from me. Thank you.
Hi, my name is Hari Azhar Jaluddin. So I'm gonna present the part of medical surveillance of dengue. So clinical cause of dengue infection is a dynamic disease. The clinical cause change when the disease progresses after the incubation period. The disease begins abruptly and will be followed by three phases. That is febrile, critical, and recovery phase. So this is the three phases. So the first one is a febrile phase. Usually, patient develop a sudden high grade fever. This acute fever phase usually lasts 2 to 7 days and is often accompanied by red face. The redness of the face, skin erythema, general body aches, myalgia, arthralgia, and headache. Some patients may experience sore throat, injected pharynx, and conjunctiva injection. Nausea, and vomiting are common. These clinical characteristics are indistinguishable between dengue fever and dengue hemorrhagic fever. So the clinical phase. occurs toward the late fever phase. Usually after the third day fever around fever vaccine, usually between the third to the fifth day of illness, but may rise to the seventh day when a rapid drop is in temperature may coincide with increased capillary permeability in some patients. In other viral infection, the patient condition improves as the temperature decreases. But the opposite occurs in dengue hemorrhagic fever. At this point, the patient will either be better in none or minimal plasma leakage occurs, or worse if the critical volume is as much plasma is lost. The critical field lasts about 24 to 48 hours, where circulatory disorder can develop. In less severe cases, these changes are minimal and temporary. Many of these patients recover spontaneously or after a short period of fluid or electrolyte therapy. In most severe form of plasma leakage, patient may sweat, become restless, and cold limbs, and prolong capillary replenish time. The pulse rate increases, diastolic blood pressure increase, the pulse narrow pressure, abdominal pain, persistent vomiting, restlessness, altered level of consciousness, accumulation of clinical fluid, mucosal bleeding, of soft and large liver is critical warning sign of severe and elevated dengue, the possibility of rapid progression to shock. The patient can progress rapidly to profound shock and death if immediately fluid resuscitation is not performed started. So for the recovery phase, after 24 to 84 hours of delay, plasma leakage stop and follow through the reabsorption of extravascular fluid, the general well-being of the patient improve. Appetite return, gastrointestinal symptoms subsided, the hemodynamical status becomes stable, and diuresis occurs. Some patients may experience a classic rash, white island in the night ocean. Uh, some may experience generalization of pruritus, changes in bradycardia and electrocardiography are not common during this stage. It is important to note that during this phase, hematocrit or HCT level stabilize or decrease further due to hemodilation following the absorption of extravascular fluid. So the WHO dengue classification. Based on the current WHO dengue classification, the key differentiating feature between dengue fever and dengue hemorrhagic fever is the presence of plasma leakage in dengue hemorrhagic fever. However, in the early febrile phase of dengue infection, the symptom can overlap and one cannot differentiate between dengue fever and dengue hemorrhagic fever. It is further classified as a mild or severe. The presence of shock in the main difference. So the limitation of WHO classification has been observed that the existing WHO classification scheme uh, has been some limitation because the disease has spread to the new infected areas of the age group. For example, uh, the dengue with shock without meeting all of our criteria of dengue hemorrhagic fever. There have been many cases reported of severe dengue patient with shock which did not meet all four criteria of dengue hemorrhagic fever. This patient is for sure classified with dengue fever if WHO criteria are to be used strictly. So the second one is severe organ damage. Patient with severe organ damage such as liver, respiratory, heart, and brain dysfunction are not arrested as having severe disease based on existing classification. Third is plasma leakage in dengue hemorrhagic fever. The requirement for a 20% increase of hematocrit is one proof plasma leakage are difficult to meet due to several issues. So the baseline hematocrit is not available in most patient areas, and therefore the test interpretation of plasma leakage can only be made retrospectively. So the last one is suggested WHO classification 2009. Classification to severity level has a high potential for being practical use in clinicians' decision about about where and how intensively patients need to be observed and treated. So this is the suggested classification and level of severity. And that's all for me. Thank you.
Hi, it's me again, Ismadin Bezuhairi. Now I will present about health surveillance part 1. The first health surveillance for dengue virus is dengue fever testing. Dengue fever testing is a blood test that specifically focuses on detecting the presence of dengue virus inside the person's blood. Uh, there are 4 laboratory tests in dengue fever test using the blood sample from the person, which is the first one, dengue fever molecular test or PCR, antibody test, IgM and IgG. The next one is complete blood count, CBC, and the last one is basic metabolic panel, BMP. Dengue fever test. Dengue fever molecular test or PCR is to detect the presence of dengue virus itself inside the blood, and it can diagnose dengue fever after first symptom occur in 7 days. The next one is antibody test, IgM, IgG. In this test, uh, it will check the antibody produced by immune system in the body in response after the person exposed to dengue virus. The next one is complete blood count, CBC. Dengue fever will cause anemia that will cause a massive blood loss, and this test is to check low platelet count and a decrease of hemoglobin and hematocrit and red blood cells in the blood. The last one is basic metabolic panel, BMP. This test is to monitor kidneys for any signs of dehydration that dengue fever will cause. To next presenter, Muhammad Iqbal Nokoyim.
Assalamualaikum. Hi, my name is Muhammad Iqbal bin Sailin. I'm from Dimosh 4A. Today, I would like to present about health surveillance for dengue disease. The first surveillance is dengue surveillance. As we know, dengue fever is a mosquito-borne viral infection that causes severe flu-like symptoms and, in rare cases, a fatal complication known as severe dengue. Dengue fever is a pandemic-prone viral illness that is spreading fast around the world, particularly in the Western Pacific region. When is exposed to one of the 4 serotypes, 1 to 4, of the dengue virus, many people suffer no early symptom or just moderate sickness. For those who are expressing symptoms, the prognosis is still quiet, as learned for complete recovery within a few weeks. In addition, workers working in sewage plants are more prone to dengue fever. This is because the workers' area is mostly filled with watery areas. This will make it easier for mosquitoes to breed everywhere. The Safety and Health Committee is responsible for conducting health screening programs for employees. For example, taking an employee's blood and further examination to prevent the employees from contacting a more serious illness. The second surveillance is fever surveillance. Sentinel clinics located in high-risk regions shall report to the National Public Health Authority on a weekly basis the number of patients since since and the number of patients with an oral or axillary temperature more than 38 degrees Celsius. This method allows for the detection of unusual increases in the prevalence for febrile disease. If they increase, an attempt should be made to ascertain the cause of the illness by viral culture and serology. And the last surveillance is dengue hemorrhagic fever case recognition. The usual criteria for clinical diagnosis and laboratory confirmation for DHF must be used. Most dengue virus infection in young children are mild and can be confused with other acute febrile disorder. Classical dengue fever is most usually observed in adolescent and adult. However, in locations where the dengue virus is endemic, local adults are frequently immune and overt sickness may be restricted to incoming vulnerable adults such as travelers. Mild dengue infection precedes and follows DHF outbreak, and the size of this simple DF may be difficult to measure. During outbreak, it is believed that between 150 and 200 cases of dengue infection develop for every patient with DSA seen in a hospital. Recognizing this is critical for developing preventive and control programs.
Okay, Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Azim Muhammad Zamli and I'm from Class Dimos 4A. In this slide, I want to present about strategy to improve the employees' health condition of the dengue fever. First is we must using a mosquito threat lamp because Aedes mosquito are inside the carries dangerous disease that can be fatal. The disease carrier by this Aedes mosquito is dengue fever. Therefore, I recommend using a mosquito threat lamp. Mosquito threat light work to attract mosquito using an LED light. Mosquito that approach the LED light will be electrocuted to death. The use of this mosquito threat light is safe as it does not emit harmful chemical on workers. The use of this mosquito threat lamp does not emit any noisy and noise that can disturb workers to do work. This mosquito threat light can be used in workplace either outdoor or indoor. Once a month, you have to clean the inside of this lamp because they are inside that due to die due to electric shock. Okay. The second one is anti-mosquito lotion. Working in an environment that has a lot of mosquito is very dangerous because some mosquito carry dangerous disease when they bite human. An example of the disease carried by mosquito after biting human is dengue fever. This fever can affect human health and can be affected in the patient antibody are weak. Therefore, one of the ways to avoid a mosquito bite while working is to use anti-mosquito lotion. Anti-mosquito lotion can prevent mosquito bite because it will interfere with neuron and receptor in the antenna and mouth of the mosquito so that when the mosquito smell it will disappear. They should apply lotion before doing a work to reduce the risk of the dengue fever. Third is fogging. The goal of the mosquito fogging operation is to kill or knock down any dengue mosquito carrying the dengue virus. After biting and sucking a blood from a dengue affected person, mosquito become infected with the virus. To prevent and infect mosquito from biting another person and transmitting the disease. Mosquito fog is being used in regions where there have been a number of the dengue cases to try to kill as many of the dengue mosquito as possible. The mosquito fogging pesticide is cyanidic pyrethroid, which is remarkably similar to the insecticides used in most households but spray cans on supermarket shelves. The fog is formed by a blasting combination of the pesticide and water through a fogging machine into very thick droplet. The quantity of the pesticide in the fog is very little, and it is disseminated in a level that can only kill a mosquito. This will be no harmful health impact on individual who are in frequent exposed to the fog at the concentration until least. In addition, the pesticide at least is a fogging has a no odor. At the time of the fogging, worker workers should leave a all door and a window in the sweep lane and surrounding the building site open, since this will allow the fog to reach the area and kill any mosquito within. Mosquito fogging activities are often conducted between the hours of 5:30 and 7:30 am and 4:30 and 6:30 pm, as this is when the outdoor dengue vector is more active and eager to bite. Wearing a long sleeve and pants as well using an insect repellent such as anti-mosquito lotion are the greatest way to protect the worker. Okay, next slide. Last. The last is remove and clean up the place stainless water that mosquito lay egg. Mosquito lay egg they are all on the water because they are larvae require it to live. Standing water may be removed by personnel and the general people like a worker to eliminate mosquito larvae before they mature into the adult flying mosquito. Workers should clean up and maintain working environment to keep them free of the standing water as well as sites where mosquito lay egg and debris in order to avoid standing water. Standing water can be removed by the personnel. If necessary, a worker can remove the bulky things such as water collecting tire and the sewage plant larvicide treat pool. Because mosquito egg grow into the larva and subsection pupae, the worker must keep larva and pupae under control. Standing water is home to both larva and pupae. One method of the controlling larva is to dump or remove standing water in and around work areas. A larvicide can be used to kill larvae in the standing water that cannot be discharged and drained. It are chemicals that destroy mosquito larvae before they mature into a biting adult. Larvicides that have been approved by the Environmental Protection Agency (EPA) are available to the general public and for personnel. As a part of the community clean-up activity, they may also maintain standing water on private land. It is possible to reduce the demand for pesticides that kill adult mosquitoes by killing larvae and pupae before they become adult. So that from just present that from me. Thank you.